As a female board certified plastic surgeon, I have a lot of women coming to me for their breasts. Sometimes they don't like the size of it. They want a reduction, or sometimes they just want them lifted. And sometimes they just want a plain breast augmentation to increase the size of their breast. The main question I get asked a lot is, do I need an implant with a lift? Or do I need an implant with reduction? Which intuitively makes no sense, because if you're reducing the size of the breast, why would you need an implant with the breast reduction? But the key factor in all of it is the shape. It's so important to produce two breasts that are as symmetric as possible, and the shape is the shape that the patient desires. So usually I ask them to bring photographs of what they consider attractive breasts, because no two people consider the same thing attractive. Some women like that very done look that looks fake, whereas some people really like that natural look where it's not too high and it's not too full on top. So based on the desires of the patient, then I see how much breast tissue they have. Sometimes women are too big and we do need to reduce them. And we do need to narrow the breast on the sides to make them look more contained within the chest, because wide breasts make women look heavy. And it's important to consider the shape whenever we're looking at the ultimate outcome. When women have breast reductions, we can create some fullness on top, and you don't necessarily need an implant. However, the longevity of the fullness and the degree of fullness might not be the fake looking breast that some women are looking for. In that case, I do recommend adding an implant to the upper pole to have that permanent upper pole fullness and that what we call fake look to the breast after the reduction. The breast lift is a similar situation. Depending on how much breast tissue is left after breastfeeding, or if the young girl just has naturally droopy breasts, which is sometimes genetic, we look at what they consider attractive. If you want a permanent upper pole fullness, yes, you do need an implant. However, with a breast lift, we can create a nice natural breast that is high and tight, like when you were 15, and continue to have that over time if you continue to keep your weight steady and wear proper bras. However, for that permanent upper pole fullness that looks fake and you want to look like you have that round augmented breast, then you do need an implant. So the basic message of this is that not everybody needs an implant. Depends on your goals, what shape you consider attractive, and we have all sorts of tools to get you to that shape. Some women want that fake look. They want that look that looks like you're augmented, even though they're just having a breast lift or even though they're just having a breast reduction. So we look at each individual and tailor make the procedure that will give them the results that they find attractive. And it's not the same operation for everyone. Breasts come in all sizes and shapes, as we all know. So it is very important to individualize this procedure to the needs of the patient and what they consider attractive. Beauty is very different in different eyes, and it's very important to look through the patient's eyes to give them the results that they're looking